Back pain is one of the most common medical problems. In fact, when you go see a doctor about it, one of the first things you get asked is, on a scale of 1 to 10, how would you describe the pain? 10 being the worst pain you can imagine. But it doesn't need to get to that point. On the show today, a closer look at how to relieve back pain, what's the main causes, and when should you seek medical advice. I'm Dr. Freddy Gomez. You're watching MedTalk Health Talk right here on CNN Philippines. Here's the painful truth. 80% of Filipino adults suffer back pain at some point in their lives. But because it's so common, there are many ways to prevent, avoid, and treat back pain. Joining us on the show are Dr. Mario Ver, orthopedic surgeon and spine specialist from St. Luke's Medical Center, and Dr. Franklin Domingo, physical medicine and rehabilitation specialist from the Makati Medical Center. Thank you both for joining us today on MedTalk Health Talk. Now, studies show back pain is one of the most leading causes of chronic pain. Kaya nga, pag meron na kayong nararamdaman, it's best to consult your doctor or your specialist. Now, let's talk about how patients first describe that pain. Dr. Ver, could you help us along with this?
Back pain is, as you mentioned, really the most common ailment that we see in our clinics as far as orthopedic surgeons. And you're correct, 80%. They present to us with that back pain, which we categorize to two types. One is the mainly back problem, no radiation, and the other one is the back pain that radiate down to the lower extremity, down to the foot, and that is what you call sciatic type of pain. So that basically two types, mainly at the back, and the one that is radiating to the leg. Okay. Those are the two types that you will see.
That's right. Now, Dr. Ver, minsan we hear doctors using a pain measurement scale. Could you please explain to our audience how this works, yung pain scale na 1 to 10, and how is this helpful for a specialist like yourself?
Okay. We call that VAS scoring of pain. It's scored at 1 to 10, 0, no pain, 10 being the most painful. Sometimes, as you correct, we can show this emoji, and with that kind of facial expression, then you can probably score it 10 the most painful. However, right now when we are seeing patients as far as back pain, we also give them what we call the functional outcome scoring. We call that the OSWES 3, and that is more accurate, and that's considered the gold standard scoring in terms of disability of patient secondary to that low back pain.
So all of these things are used as tools by the specialist like Dr. Ver in order to properly assess a patient with regards to the level of pain that they may have. Now, back pain is caused by injuries or accidents, but they're not the only ones. Dr. Domingo, let's discuss the conditions that can cause or may cause back pain. What are among these painful conditions?
There are a lot of conditions that can cause low back pain, and based on the anatomy of the spine, we can actually see that there are bones, there are ligaments, there are intervertebral discs, and there are nerves, and there are muscles that surround this area. And any of these structures can be potential pain generators, including, of course, the sacroiliac joint.
Now, when it comes to accidents and injuries, those can be prevented. Number one, be careful when lifting heavy objects. Ano ang technique sa pagbubuhat so we do not compromise our back or minimize the risk of compromising our backs? Dr. Domingo.
Good question, Dr. Freddy. What is important is to, of course, observe the right biomechanics. What is this? You have to bend your knees and bend your hips both at the same time when picking up an object. It's very important that you do this so that you don't get to strain your back. You have to use the powerful leg muscles that you have in order to lift heavy objects, especially when you go down to the floor level.
Okay, now for Dr. Ver, can a person's weight become a factor when it comes to back pain? How can a person who may be overweight, say overweight, how can this cause back pain?
Okay, you're correct. Obesity or overweight is one of the risk factors for developing low back pain, like so many others. So obviously, if you have significant load to your spine, then your spinal column, which is in the practically the one that carries your load of your head, upper trunk, and that structure is obviously subjected to wear and tear and load. So if you have bigger load, then the wearing and tearing will be more. So as mentioned by our colleague Frank, your discs is a shock absorber there. Okay, that is a one of the weakest structures in the back. It has no blood supply, and you're using it. If you have more load to it, the chance for that shock absorber, you call the disc, to be damaged, to crack, to bulge, will be higher.
Okay, so the less load we have on those discs, the better. Now, research also shows that upper or lower back pain develops during the course of our day-to-day life. I keep thinking of our work-from-home situation. In this type of situation, good posture is definitely key, hindi ho ba? Now, perhaps we need a checklist to measure or to make sure we are seated comfortably in front of our computers, for example, and not causing tension and muscle tightness that may result in back aches. Now, what is your advice with this, Dr. Domingo? What's the best posture, for that matter, for those in the work-from-home situation?
That is a very relevant question, Dr. Freddy. A lot of people are working from home, and a lot of people are actually having more back pain right now because they're slouched. Their shoulders are more moving forward, and their head is also moving forward as they look at the monitor. And worse than that, sometimes the screen is not at the right level. So the screen should be at around eye level. And if you could sit comfortably on your chair with your knees and your hips being at the same height, if you may need to use a footstool, that would be great. Make sure that your chair would have a armrest and that you sit all the way to the back so that you can actually take advantage of the lumbar support that your chair may have.
Okay. Now we'll talk more about back pain prevention and tests later on. We'll specifically address the different tests that need to be done in order to understand the reason for or the cause for those backaches. This is Med Talk Health Talk here on CNN Philippines. Back pain is so common. It's also one of the most popular reasons why people go see a doctor or a medical practitioner. Welcome back to Med Talk Health Talk. Dr. Ver, are there people who are more prone to back problems?
Good question. One, there are risks factors, as mentioned, obesity, smoking, those that work with repetitive lifting, bending, sedentary lifestyle, sports that are more at risk are those with rotatory and pivot movement that put a lot of load into your back, like golf, baseball, and even contact sports. So these are predisposing factors that will give you significant risk for back pain.
Now, the treatment for back pain will depend on the cause of the back pain, of course. Now, how about the different options for treatment or and later on therapy? But let's start first with the treatment options first. Dr. Ver, could you help us out on this?
Okay, most back pain, fortunately, are benign, doctor. So rarely will you go for interventional treatment in most cases. If you look at the natural course of back pain, 60% of the acute back pain sufferer will improve even without doing anything. By 8 weeks, you're looking almost at 80%. That will improve even without treatment. By 10 to 12 weeks time, almost 90% will get better. Unfortunately, after 12 weeks or 3 months, if you are still suffering from back pain or you have at least recurrences of back pain, the chance for you to have significant improvement or to deteriorate becomes higher. But the message is back pain is relatively benign. And treatment is usually bed rest, no more than 2 days. We'll give you some painkillers. Okay, some will give muscle relaxant just to help the patient bear the pain for the meantime.
Okay, that's good to know. It's relatively benign. It will spontaneously resolve. But in case the back pain does continue, that person will inevitably have to see a doctor. And after the initial conversation that you have with your doctor or specialist, that person will probably be advised to go through some imaging tests. Maraming nagtatanong, Dr. Ver, is masakit po ba ang mga tests na ginagawa in order to find out itong mga back pain or yung cause ng back pain?
So if you are not improving at least 6 weeks, or you have other risk factors that we consider that this is not a benign problem, then X-ray is still the number one that we will request. Okay. However, X-ray will only show you mostly the bone. The alignment, if you have some instability, yes. So it's very, very helpful. That's the standard that we will ask. In case a patient will have significant pain that is not responding to conservative treatment, well, and presenting to us with tension sign, meaning sciatica, or with neurologic deficit, then the most important, or probably the gold standard, will still be your MRI of the lumbar or the neck, whichever is hurting.
Okay. Now, there are some studies that suggest acupuncture may help ease chronic low back pain and neck pain as well. What are your thoughts on this, Dr. Domingo?
Yes, for patients who have tried conservative means of treatment and yet are not good candidates for surgery, you can consider acupuncture. It's a viable treatment option which we can use. It uses actually your body's own healing mechanisms to be activated so that you can actually use your own body to heal yourself. So that's how acupuncture basically works. And what I really think it does is that it helps your muscles in the back to relax. And when we do acupuncture sessions, we can help these muscles to relax. And when these muscles do relax, pain can be more controlled. Again, we cannot promise 100% pain relief, but what we can do is we can at least offer the control of pain. And according to the World Health Organization, especially for chronic back pain cases, if we can reduce the pain by about 50%, that would be the gold standard.
Ngayon, mapunta naman tayo sa pain medications. The question is, what are some of the different types of medications that are used, and how does one differ from another? Dr. Ver, you mentioned earlier the use of pain relievers and muscle relaxants. When is one used and compared to the other, or are both used at the same time? Is that the best option?
Okay. Well, as far as pain medication, evidence-wise, there is no difference between ordinary paracetamol or the non-steroidal anti-inflammatory drug like your coxib group. There are no difference in terms of efficacy. Okay, muscle relaxant is being used for acute pain. If it is more than 3, 4, 5, 6 weeks, then maybe it is not anymore that helpful.
Still ahead on the program, we'll revisit back pain home remedies. This is Med Talk Health Talk. Keep it here on CNN Philippines. I'm Dr. Freddy Gomez, and welcome back on the show. This is Med Talk Health Talk on CNN Philippines. Back pain is so common. 8 in 10 Filipino adults suffer from it at one point or another. But there are ways to ease the pain, manage, or even prevent it. And as we mentioned earlier as well, the way we stand and sit will also make a difference in the potential to causing back pain. Dr. Domingo, can we discuss why posture is so important? It's taken lightly, taken for granted, but it is an aspect that is really important. Why is a good standing or sitting posture needed para maiwasan ang back pain?
Great question. What happens actually when we have poor posture is that our body's center of gravity shifts, and it actually usually shifts a bit forward, which will cause our back muscles to overcompensate and become overworked. And when they become overworked, the propensity for having pain increases much higher. And we have to always make sure that we're seated correctly, like I described earlier, and that while sitting down, make sure that when you're in front of the computer, you take frequent health breaks. After about 30 minutes to 45 minutes, make sure you stand up and stretch. That's very important, of course. Also important, of course, in standing is to pull your shoulders back and stand up straight so that, again, your center of gravity is maintained where it should be so that the chances of having low back pain will be much less.
So my question for you, Dr. Domingo, now is how can maybe massages and regular exercise help with back pain?
Exercise can actually help by improving the strength of the muscles that support the back. Any exercise is good, walking is good, swimming is even better. What we should avoid are exercises that would put too much weight on the vertebral column that we have. High impact exercises like running may have to be avoided for patients with low back pain. For patients who are still suffering low back pain, we suggest that they avoid bed rest and that they walk as the pain would allow them to, and that they do their regular activities as soon as they can to avoid immobilization from giving us the poor or the side effects that we don't like, such as muscle atrophy and the like.
So exercise talagang kailangan natin, not just for the back, but it's good for our overall well-being. Now, aerobic activities like walking, running, or jumping rope give your heart and lungs the kind of workout they need so they can function efficiently. Plus, as we said, muscle strengthening. These are activities that help build the core strength and are good for our posture. But here's something worth noting when it comes to lifting. We have to be super careful when we do this. We mentioned this earlier, but we want to revisit this topic because it's so important for preventing back injuries. Whether you do this as a regular exercise or lifting is a part of your job, or you accidentally lift something that might cause damage to your back or cause pain to your back. So ano ba dapat ang mga bagay na kailangan natin ingatan sa pagbubuhat? I'll throw this question to Dr. Ver.
Let me reiterate, before the treatment, if you're suffering from acute back pain, number one is bed rest. Long period of time before, 7-10 days. Now, we don't treat back pain unless it's very painful to put them in bed rest. Okay? We want them to be relatively more active than lying down, because it has been found out that it is much better for recovery. As mentioned, atrophy of muscles will be prevented and the rest. In terms of, yes, you have to be more active because it has been found out that those patients who are having back pain that remain to be active doing exercises have shorter attack and fewer recurrences. And granting that you will have to undergo intervention, surgical intervention, the chance for you to have better outcome if you are active and good muscle function, then your outcome will be much better.
And with that, we'd like to thank our guests for this very thoughtful discussion. Salamat, orthopedic surgeon and spine specialist Dr. Mario Ver and physical medicine and rehabilitation specialist Dr. Franklin Domingo. We enjoyed speaking with you on the painful truths about back pain. And to all of you, we hope the facts, figures, and advice we discussed today have helped you. Remember, in this time of COVID-19, stay safe, maintain social distancing, and observe good personal hygiene. I'm Dr. Freddy Gomez. Thanks for watching.